Thank you, Madam Chairperson. I believe I'm on familiar ground, having been a long-standing MP in my country and also a PGA member. I'm sure a good number of MPs here are members of the Parliamentarians for Global Action, PGA. Bring you greetings. Madam Chairperson, Excellencies, colleague ambassadors, honorable members of the Committee on Development, distinguished participants, ladies and gentlemen, let me at the outset express my profound appreciation to the committee for convening this important meeting to exchange views on the Ebola epidemic in the Mano River Basin, particularly in my country, Sierra Leone, as well as Liberia and Guinea. The meeting at this crucial time underscores the heightening concern of the international community, with special reference to the European community and our development partners in the outbreak of the Ebola virus disease, EVD. Let me also congratulate you on your recent successes at the polls in April, May this year to the European Parliament. Some of you for the first time, while for others it is repeated innings. Since the index case in Sierra Leone was recorded in May this year, after the first case appeared in neighboring Guinea in March and subsequently in Liberia, the government of Sierra Leone, in collaboration with its development partners, has continued to mobilize and deploy resources to contain the spread of the virus. In its response to this crisis, the government set up a coordinating mechanism with the World Health Organization, Médecins Sans Frontières, MSF, UNICEF, and other international bodies. It also set an interministerial committee to mobilize ministries, departments, and agencies behind the initial 6 months comprehensive strategy with a view to coordinating support activities and other extraordinary measures required to contain and control the spread of epidemic disease. Accordingly, the launch of the 60 to 90-day accelerated EVD outbreak response plan in July in collaboration with WHO, MSF, and other international organizations generated intense awareness and the need to address the gap in the financial resources requirements to support the response plan. A state of public health emergency was declared in August to create space for the extraordinary measures necessary for quarantining epicenters of the disease, restricting public gatherings, introducing and enforcing new burial protocols throughout the country. Additionally, measures were put in place to create awareness about the disease by local government authorities, religious leaders, NGOs, CSOs, musicians, market women, traders, the media, and the general public. An important aspect in the application of control measures was the surveillance and contact tracing, which is vital to containing the person-to-person transmission of the disease, particularly in view of the nature of the communal setting and close social and personal interaction in existence in Sierra Leone. Madam Chair, considering that the disease has mainly engulfed 3 out of the 4 countries, excluding Cote d'Ivoire, in the Mano River Basin, and taking into consideration our responsibility to prevent its international spread, the government of Sierra Leone undertook a coordinated approach within the framework of the MRU and ECOWAS by convening a summit-level meeting on 1st August 2014. Among other things, we agreed to measures to not only manage the containment of the disease, but also, importantly, to prevent its international spread through robust exit screening at airports and borders. These measures also require the support of the international community, particularly to help build capacity in the fight against Ebola. Although there has been some positive response to this call in terms of financial, medical and logistical support, the region is still overwhelmed by the immense challenge of acquiring the resources needed to combat the disease. After the summit, the government of the Republic of Sierra Leone took the appropriate steps to address some of these concerns expressed by the general public and our development partners by taking the following actions. 1, enhance the capacity of holding centers spread across the nation by providing additional hospital beds, staff, and equipment. 2, increase laboratory capacity to test and report on specimens to facilitate timely confirmation. 3, procured additional capacity, additional ambulances and vehicles for increased logistical support. 4, procured additional supplies of personal protective equipment, PPE, and supportive medicines to health facilities. 5, recruited and conducted Ebola-specific training for different cadres of health workers. And 6, increased and expanded the capacity of an emergency call center. Just this past week, Madam Chair, the government of Sierra Leone took an extraordinary measure of asking its people to stay at home for 3 days for a national house-to-house sensitization, monitoring, surveillance, and contact tracing exercise. The objective of this house-to-house, which we call in our local parlance host-to-host campaign, were as follows: to reach 100% of households with correct information on Ebola, to increase community acceptance of Ebola-affected persons, especially children, to promote hand washing with soap, for which 1.5 million bars of soap were distributed, to rebuild trust in the healthcare system, to install neighborhood watch structures at community level. Chair, despite the fact that the fight against Ebola has engulfed almost all the entirety of government activities, we continue to see an escalation of figures of infected persons and a rise in the number of lives lost to the disease. We are in a very unfamiliar territory, and our fight against the disease is taking its toll on our economy and the well-being of our people. Our people live in fear and cannot understand the nature of a disease that claims a life and prevents family members from burying their loved ones. Despite the deployment of various measures, the crisis has deepened, and the virus remains one step ahead of our best efforts. As of today, there are 1,745 confirmed cases, of which there have been 505 confirmed deaths. The nature of the virus is such that it has claimed the lives of people trained to deliver health care, and to date, we have lost over 34 of our courageous medical personnel in the struggle, including 4 medical doctors. This has contributed to the spread of fear, which has created further difficulties in our response to non-Ebola related diseases, as most private clinics and hospitals have either scaled back operations or shut down completely. As the international community and the EU in particular can testify, having been fully involved in our post-conflict peace consolidation and peace-building activities, Sierra Leone has made tremendous progress in state building, such as strengthening our state institutions and deepening democratic governance, rule of law, promotion of human rights, and empowering women in our country. The withdrawal of the United Nations Integrated Peace-Building Mission, UNIPSIL, in March this year, after an internationally acclaimed success story, is a testament to the progress we have made. Economic disruptions are already being felt. Inflation had been reduced to single digit for the first time in 5 years, reaching 6.5 in April 2014, from 12% in December 2012. This is now on the upward trend, approaching 8%. The IMF has estimated that the GDP will drop by 3.3%, lowering overall GDP estimates from 11.3 to 8%. The impact on the economy in just 5 months has been profound, and projections for the future as the crisis lingers is foreboding. The country's remarkable post-conflict achievements are in peril of being reversed. Throughout the country, the impact of this crisis is being felt in all spheres of life, and of special concern is the impact on the educational sector as schools, colleges, and educational facilities or institutions remain closed for the foreseeable future. Chair, Sierra Leone, Guinea, and Liberia are still very much a part of the international community and wish to continue to play their respective roles on the global agenda. Today, while we are struggling under the enormity of the task we face in containing the outbreak, we plead with countries that have imposed travel restrictions and flight bans to revisit their decisions, as this hinders the work of WHO, MSF, and many other development partners from bringing in much-needed logistics and medical personnel. Given the regional nature of the Ebola outbreak, the West African ambassadors in Brussels, together with the support of the African Union, AU, and the African Pacific Group of States ambassadors, have embarked on Ebola diplomacy and taken the Ebola diplomatic offensive with an appeal to our development partners for more assistance, medical, financial, technical, etc., to contain, roll back, and eliminate epidemic. Madam Chair, let me take this opportunity to express the Sierra Leone government's and the region's heartfelt gratitude to the EU for their response to the EVD outbreak with the recently announced package of 150 million euros, inclusive of the earlier 12 million euros as budgetary support to the respective governments, and the commitment to further provide budgetary support and the strengthening of our health sectors with 38 million euros out of the new package, which is specifically designed to bolster the health services of our respective governments, both during the crisis and in the recovery phase. Additionally, to provide support in the areas of food security, water and sanitation, which are essential in terms of safeguarding the health of the population. We are further encouraged by the announcement during the West African Ambassadors meeting of 19th September 2014 with the European External Action Service, EEAS, of the additional 80 million euro that may be provided from member states' contribution as part of the comprehensive EU response to the Ebola crisis. Chair, finally, we also want to thank and entreat our EU parliamentary colleagues to continue providing us with your worthy parliamentary support in the fight against eliminating the Ebola outbreak in our region. Thank you for your rapt attention.